Hi, Neva Herzig here from Core Dynamics Physical Therapy in Englewood, New Jersey. In one of our last videos, we were talking about danger and safety. Danger in me and safety in me. Today, we're going to chat more about words and stories. Everybody has a story. And some of those stories are probably influenced by where you've been. So for my example, it's in the healthcare world. Most of my patients have been to maybe several PTs, a whole lot of physicians, a few psychotherapists, and the whole gamut. And they come in and they say, I'm unstable, I'm broken, I need to be fixed. In fact, I often know when patients are coming in from other healthcare professionals or whether they're reading a lot on the internet or on forums, because they tend to use more of these words. And I take the blame. I also have used those words in my patients. I used to tell patients their pelvis is unstable. Well, what does that really mean? Does anybody actually really know? So let's do a little exercise. Close your eyes. And say to yourself, my pelvis is unstable. What do you see? What does that look like to you? Now say to yourself, my pelvis is rock solid strong. What does that look like to you? Most likely you're going to get two different visions. Let's keep those eyes closed. Now say to yourself, my pelvis feels like a hot burning poker. Or you can try, my pelvis is just not feeling the best it can today. Again, two different stories, two different visions. What will happen if we start changing some of our stories? I'm not saying lie to yourself. I'm just saying using words that may be a little bit more understandable to you and may make the story a little bit less painful. So when you come into my office and you tell me I need to fix you or that you are broken, I start wondering, where are the broken pieces? Where are the things that are dangling off? And I say to myself, this isn't broken. This is just not feeling well. And what can we do to get through that? What are the resources? How can I guide you to a different way? I hear this also with patients talking about their exercise program. I'm scared to do this, or I'm scared to do that, or it's gonna hurt me more, and what if it does hurt me more? And these again are starting to create more and more stories and a little bit more anxiety, right? So what if you say to yourself, I may not be able to do that exercise in the next few days, but perhaps I can get to it in the next few weeks. Again, it's a different story. If any of you have worked with little kids or have little kids, they fall down and they immediately look up to see what adult is near them. That adult goes, and then the baby or the child starts crying. It's reflecting back from that story. If you do that to yourself every time, you're going to help yourself create that story. And that story may guide you into seeing that the world has more pain in it versus the world that has less pain. So what can you do to start changing your story? Well, what works well for you? Think of something that you do. It doesn't have to be exercise. It doesn't have to be your physical activity that you do well, okay? And then use the tips that you do to do that well to do something that is not as great for you. So for example, I could say, I get my things in order, I'm organized. How can I organize my other things to make them better? Or I may be better at one sport, but I'm not as good at another sport. What can I use and what do I do to be better in that sport to create the other sport to get better? It's almost being like your own cheerleader. And how can you be your own cheerleader? It's okay to have bad days. We all have them. It is really okay. But if we start creating a story that's a little bit more brighter and a little bit more positive and a little bit friendlier with words, we might see that our level of pain does diminish and reduce. It may not be perfect. We're not all gonna get to 100%, but we can do our best to try to get there. Thank you.